Hi everybody, welcome back. Today we're going to be talking about when beauty treatments go wrong. Specifically, I'm talking about all types of laser treatments and the most common injuries and what we can do to prevent and repair. So first and foremost, I just want to update you guys, if you didn't know this already, there are absolutely no federal laws in place currently that regulates who can fire a laser. Now, of course, each and every state is going to have their own individual laws and regulations, but every state is different. Now, since 2012 up until today, there's been a huge increase in patient injuries and legal claims made against non-physician operators, specifically in med spa environments. 71% of all legal cases were performed by non-physician operators or physicians that are not in dermatology or plastic surgery. And I'm sure you guys have either seen or had the experience of going into a med spa, a hair salon or nail salon sometimes, or one of those countless franchises. I won't name names, but more than often they employ undertrained providers. Now, most of you that know me and have watched this channel are probably thinking, well, aren't you a medical esthetician, like a non-physician operator? And yes, I am a medical esthetician. However, I have over 14 years experience working specifically with energy-based devices, and I've been lucky enough to work for doctors that have facilitated my advanced training. So now let's get into the most common types of injuries. The most common injury from all types of lasers is going to be burns or blisters. Now, depending on if this is a second or third degree burn, this can also leave you with permanent scarring, which is hypopigmentation or hyperpigmentation. And aside from adequate cooling, it can also be an issue of choosing the wrong laser wavelength for that patient's skin type. And the last cause for burns is actually technique driven. So the laser should always be perpendicular to the skin for the safest outcome. And usually this goes without saying, but you want proper sanitation, wiping the lens down before and after each treatment, because unfortunately there can be a charring effect which also can lead to burns. So what do we do when we have some type of burn? Now, if it's the hypopigmented burns that come from that stamping IPL treatment or BBL treatment, the best thing you can do is give it time and, in fact, a little sun. A little bit of sun exposure will actually help those melanocytes repigment much faster. If you've tried that already and it's been over a year and nothing seems to be changing, then check out the video I did above. I use this technique for my surgical scar patients and it works every time. Now, for those of you that had a burn that caused hyperpigmentation, the best news is this is super easy to treat. You can usually use an at-home bleaching cream, sometimes an in-office treatment with a chemical peel, retinol treatments, any type of tyrosinase inhibitor like kojic acid, vitamin C, or azelaic. And if we move into the second type of laser burns, this is unfortunately more common in my male clientele. However, what happens is they come in for a vein treatment. They want to get rid of a blue or red vein on their face. And because they have thicker hair follicles or beard hair, what happens is some types of lasers cannot differentiate between a vein and a hair follicle. So you end up putting way too much heat in the skin, which then results in necrosis of skin tissue. And really the best treatment is to first give it time to heal, and then we can use a lot of the treatments that we actually use for acne scars to help lift that indent up higher to the skin, including some filler. Now, outside of burns, this might happen to you as well. This one is called chrysiasis, and what happens is people tend to get a grayish or bluish hue on their skin following a pico or Q-switch laser. And this can be a result of not going thoroughly through somebody's medical history. So if somebody has had rheumatoid arthritis and they've had gold treatments and they actually have gold in their systems, the laser will interact with that gold and cause this bluish grayish hue. And adding to that, I actually want to mention another case that I've only seen once, and that was with a patient that had silicone injections. And this was back in the 90s. She was getting treatments from her dermatologist for her acne scars. And back then they were using silicone to help with the indents in the skin. Well, for those of you that know, silicone doesn't go away. It's in the skin for a long time. So what had happened is she went to a facility. She got a series of laser genesis treatments, which is supposed to build collagen through using like a 1064 laser to heat up the skin. But the 1064 is a very long, deep pulse laser, and it was heating up the silicone. So literally she had black silicone oozing out of her pores, and ultimately she had to go in and get it all cut out. And the last thing on the list is ocular injury. Now this only makes up 3% of all reported cases in the United States, but it's super important to talk about because no matter what device you're having done, you should always be wearing some type of eye protection. All right guys, thanks so much for joining me yet again. And if anything, I hope this video was a good reminder as to why we need to really do our research before we head in for a laser treatment. All right, I'll talk to you again soon. Bye.